Hi, I'm Dr. Magnus, and I'm going to be going over discharge instructions for a cruciate ligament repair. So when you pick up your dog today, you should have discharge instructions that are written out, and we're going to go over these written instructions, and you will have them at home as well in order for you to know what to do with your pet. So Dr. Reese, who has performed the surgery, would like you to monitor the incision every single day. The best thing to do is take a picture of the incision when you get home. This way you have a picture of it from this day moving forward, and you can make sure that it looks the same. A little redness, a little swelling is totally normal. There should not be any discharge. If there's a tiny bit of blood in the first 24 hours, that's okay. But after that, there should be no discharge. And if there is discharge, you need to call us right away. Your pet should not be allowed to lick or chew at the incision. If your pet is licking or chewing at the incision, you need to have an e-collar for your pet. So be sure to place that e-collar on so they cannot reach the incision and destroy the incision. A dog can actually destroy an incision in less than 5 or 10 minutes. You will notice that your pet does have skin staples. Those are staples on the outside that will need to be removed in 2 weeks. Be sure to schedule that appointment today. It's pretty common to have a lot of swelling and bruising around the area of the incision. The reason being is that is where the surgery was performed, and a lot of muscles and things like that were moved. So if there's swelling and bruising, it's okay. Your pet does need to have exercise restriction. And so no running, no jumping, no crazy play, and must go outside on a leash only. Outside to pee and poop, and then come back in. Your dog may need to have a towel to support him underneath his back end when he goes out, because he may feel a little bit wobbly on that back leg alone. So use towel support if needed when he goes outside to pee and poop. Once he's done his business, he comes back inside, and then he needs to rest. No running around inside. If he needs to be crated, please do so. It will probably take 2 to 3 weeks before your pet actually uses that leg. And so don't be alarmed if your pet is not using that leg for the first 2 weeks. You will have physical therapy to do on the leg. It is explained within your discharges, and we will send you a separate video on how that is performed. You are also going home with medications. The medications you're going home with, one is an anti-inflammatory called Carprofen. You will give that every 12 hours, and you will give it with food. It is labeled correctly. Make sure that you read the label directions as to how much to give. You will want to start your Carprofen tomorrow morning with food. Another pain medication you are given is gabapentin. Gabapentin is for pain, and you want to start that this evening when you get home. Gabapentin does cause drowsiness, so it will make them sleepy, and you will give that twice a day. Be sure to read the label. And then tomorrow morning you will start an antibiotic called cephalexin. Cephalexin is also given 2 times a day and is meant to be given with food, and you will give it until it's all gone, and you will start that tomorrow morning. Anytime we put a pet on antibiotics, we also put them on probiotics. The probiotic you're receiving today is ProViable. Please give that once a day. Please start that tomorrow. Do not give this with this. So antibiotics and probiotics cannot be given together. Give them at separate times. You will also need to make some follow-up appointments. You will need to have those staples removed in 2 weeks, and in 8 weeks we will recheck the leg to make sure everything's okay, and in 10 weeks you will have x-rays. You will also have laser therapy sessions that will be scheduled for you today as well. Those will happen over the next 2 weeks, and those help for swelling and pain and healing. Should you have any questions, please call us here at the hospital. Thank you.